Hepatitis C. What is that? Well, to understand what hepatitis C is, we first need to learn about the liver. The liver is located underneath the right rib cage. It is the largest organ in the body, about the size of a football, weighing around 4 pounds. The liver serves as the body's filter and warehouse. It converts food into nutrients, stores vitamins, minerals, and sugars, produces bile, and detoxifies substances that are harmful to the body. Hepatitis means inflammation of the liver. In other words, hepatitis means the liver is swollen. Many things can cause the liver to become swollen, including toxins, heavy alcohol use, certain drugs, bacterial infections. Hepatitis is also the name of a family of viral infections that affect the liver. The most common types are hepatitis A, hepatitis B, and hepatitis C. Hepatitis C is a contagious liver disease that ranges in severity from a mild illness lasting a few weeks to a serious lifelong illness that attacks the liver. There are 2 stages of hepatitis C. It can be either acute or chronic. Acute hepatitis C virus is a short-term illness that occurs within the first 6 months after someone is exposed to the hepatitis C virus. Approximately 70% of people with acute hepatitis C do not have any symptoms. In fact, many people who are infected with the hepatitis C virus do not know they are infected because they do not look or feel sick. If symptoms occur, the average time is 6 to 7 weeks after exposure and can include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pain, or yellowing color in the skin or eyes known as jaundice. For most people, acute infection leads to chronic infection. Chronic hepatitis C virus infection is a long-term illness that occurs when the hepatitis C virus remains in a person's body. Hepatitis C infection can last a lifetime and result in long-term health problems including scarring of the liver, called cirrhosis, liver failure, liver cancer, or even death. It is the leading cause of liver cancer and the most common reason for liver transplant in the United States. Of every 100 people infected with the hepatitis C virus, about 75 to 85 people will develop chronic hepatitis C virus infection. Of those, 60 to 70 people will go on to develop chronic liver disease. 5 to 20 people will go on to develop cirrhosis over a period of 20 to 30 years. And 1 to 5 people will die from scarring of the liver or liver cancer. Hepatitis C is usually spread when blood from a person infected with the hepatitis C virus enters the body of someone who is not infected. People can become infected with the hepatitis C virus during such activities as sharing needles, syringes, or other equipment to inject drugs, being a recipient of a blood transfusion or blood clotting factor before universal screening began in 1992, healthcare exposures as a result of needle stick injuries or lapses in sterile technique, being born to a mother who has hepatitis C. Approximately 6 of every 100 infants born to hepatitis C infected mothers become infected with the virus. Transmission occurs at the time of birth, and no prophylaxis is available to prevent it. Less commonly, a person can also get hepatitis C virus infection through sharing personal care items that may have come in contact with another person's blood, such as razors, toothbrushes, nail clippers, and glucose monitors. Having sexual contact with a person infected with the hepatitis C virus, such as engaging in rough or anal sex. Body art, such as tattoos or body piercings, particularly in correctional facilities or performed by unlicensed artists. Some people are at increased risk for hepatitis C. Therefore, testing for hepatitis C is recommended for certain groups. These groups are sometimes called risk groups. Today, Most people become infected with the hepatitis C virus by sharing needles or other equipment to inject drugs. Therefore, people who inject drugs or have injected drugs in the past, including those who injected drugs only one time or many years ago, are at risk for hepatitis C and should be tested for hepatitis C. Before 1992, when widespread screening of the blood supply began in the United States, hepatitis C was also commonly spread through blood transfusions and organ transplants. Therefore, recipients of donated blood, blood product, and organs before 1992, people who received a blood product for clotting problems made before 1987, and recipients of blood or organs from a donor who tested positive for the hepatitis C virus are at risk for hepatitis C and should be tested as well. Other groups at risk include people who spent many years on dialysis, people living with HIV infection, people with known exposure to the hepatitis C virus, such as children born to a hepatitis C positive woman, or healthcare workers after needle stick or sharps exposure to hepatitis C positive blood. In addition to these groups, CDC now recommends that anyone born from 1945 through 1965 get tested for hepatitis C. These individuals, often referred to as baby boomers, are 5 times more likely to have hepatitis C. The reason that baby boomers have high rates of hepatitis C is not completely understood. Most boomers are believed to have become infected in the 1970s and 1980s when rates of hepatitis C were the highest. Many baby boomers could have gotten infected from contaminated blood and blood products before widespread screening of the blood supply in 1992. Others may have become infected from injecting drugs, even if only once in the past. The hepatitis C test is not usually part of routine testing, so individuals at risk need to ask their doctor about being tested for hepatitis C. In Michigan, some local health departments provide hepatitis C testing. There are 2 stages of hepatitis C testing. The first is a hepatitis antibody test. This test checks for proteins known as antibodies that the body produces to fight the virus. If this test comes back negative, it is unlikely that the person tested has hepatitis C. If the test comes back positive, it means the person has been exposed to the hepatitis C virus and needs further tests to confirm if they are currently infected. The second stage of testing is hepatitis C RNA test. Another name used for this test is a PCR test. If this test comes back negative, the person tested does not have hepatitis C. If this test comes back positive, the person tested currently has the hepatitis C virus and should talk to a doctor experienced in diagnosing and treating the disease. There are several medications available to treat chronic hepatitis C. These treatments often result in a sustained virologic response, or SVR, a marker for cure. Individuals currently infected with chronic hepatitis C should speak with a healthcare professional to discuss their treatment options. For more information on viral hepatitis, visit www.cdc.gov/HEPATITIS.